Welcome to the Therapy Corner. Good to see you all again. Today we are very privileged to have Dr. Stephen Razo with us. Steve is a licensed clinical psychologist and a licensed marriage family therapist. He's an adjunct professor at Antioch University in Santa Barbara, and he also does clinical supervision of associates here in Santa Maria, as well as holding down a private practice in Ventura. So he's not only involved in a lot of things, he's a little scattered all over the map there, Steve. And he has a really fascinating topic today, one that affects many of us in the mental health field and others who are in caregiving situations. So it's all yours, Steve. Go for it.
Well, it's a pleasure to be here. Coming in today, I wanted to talk about burnout. Burnout, my first interest in burnout started way back when. It seems like a long time ago, but it was fairly recent. I was an MFT trainee long before I was a psychologist. And I was trying to accrue hours towards my degree, and I worked with a lot of colleagues at this clinic. And even though we were all on the same level as far as education and hours, we began to take different career trajectories. And one of the things I noticed, actually I noticed several things, but one of the main things I noticed was that the demands of the work seemed to impact us in different ways. Some clinicians fell behind in paperwork, some called in sick, some even quit the mental health field and chose to go a different route. So that experience kind of, provoked my curiosity about burnout. Is there something going on as far as not just the clinical work, but what's going on, in the process, what's going on as far as the stress and the administrative task that may contribute to many clinicians being burdened and being exhausted and totally, giving up on the field. Mm-hmm. So that was my first introduction to burnout. Got more experience in the field, but came back to it when I was doing my research for my doctoral degree. And I decided to take a burnout again and study it more from a scientific point of view as opposed to just, this is burnout. I'm tired. Does that mean I'm burned out? Or I'm not motivated? I wanted to really pin it down. What is burnout? So that's how I got started on the topic.
Okay. Yeah. It's currently we see, at least within our field, I know we see a lot of seminars that are being provided for clinicians to help them to deal with burnout. So let's start at the bottom. What is burnout?
So that's a good question. What is burnout? Because I think, in our experience, we probably hear a lot of people complain that they're burned out because maybe they're tired, maybe they're not as interested in the job. So there is a scientific definition of burnout. It has been quantified. Christina Maslach from UC Berkeley is like the foremost authority on the topic. So she's come up with a way to measure it. And so to define burnout, you're looking at three different components. The core component would be emotional exhaustion. So the experience of not just being exhausted, but it also includes having resources to cope with the exhaustion. So it's one thing that, I'm feeling a little overwhelmed and just feeling, just going through the motions. It's another thing to not have resources.
When you say, resources, what are you talking about?
Right. So kind of the things you were just saying, having colleagues, having loved ones, family, friends, having maybe hobbies or interests that you utilize to deal with feeling overwhelmed with work. So it entails those things. They sound simple, but in our profession, sometimes it could be difficult to go up to someone and say, I'm feeling overwhelmed with work. I don't like my job. My heart's not in this. Sometimes that may come with a little judgment, or even if it's not real judgment, some perceived judgment. So it's we have to have resources to cope with feeling overwhelmed. So it does entail things like self-care and other things that I think I'll talk about a little further. But essentially that would be the core component.
Okay.
And then you have feeling depersonalized, feeling detached from your work. It's sort of a sense of cynicism, kind of, not thinking that your work's important. I keep work, I keep my personal life, but it's just a job to me. It becomes less meaningful.
Okay.
That would be another component.
So some compartmentalizing is taking place, and yet it doesn't sound like it's particularly I'm going to use the word healthy or functional way to deal with it.
Right. It's almost like a cynical approach to mental health.
Okay.
Or even just in the helping profession in general, it's just like this, this doesn't work, this is just kind of what I do, we're headed nowhere. It's just this sort of attitude. So it's almost like a cognitive component. If emotional exhaustion is the sort of affective component, depersonalization is the cognitive component to burnout. And then finally, the third component would be personal accomplishment, feeling that what you're doing has value, feeling there's some inherent meaning in your work, feeling successful, feeling like you get results. Because we're in a profession where it's hard to tell whether we're being effective sometimes unless we're tracking heavily the trajectories of the clients. But there is this sort of it's like a sense of what I'm doing is meaningful, what I'm doing helps, and essentially believing that that you're effective and doing important stuff.
So how do we begin to recognize that we're burning out?
Great question, because if you were to go in the research and try to find ways we recognize burnout, you might not find much. So that's one of the issues is the Maslach burnout inventory is how we measure burnout, but it measures it when it's already happened. So in some of the research I've done, I did a qualitative study, interviewed a group of MFT associates, and I was able to identify some cues in recognizing burnout. And some of the cues that were reported include, fatigue, looking forward to the weekend, being not exercising as much, not doing things that you usually do after work or before work, not being as active with clients. So if, for example, if you're a clinician who does a lot of active interventions like play therapy or some of the behavioral approaches where you're interacting collaboratively with the client, you may be less active. You may kind of take a passive stance and just kind of look at the clock, session start, when does it end?
I have to interrupt you there because I had a sort of a funny incident happen to me. It was the first time I recognized there's such a thing as burnout in our field. It was many years ago, and I was sitting with a client who was telling me about all their difficulties and problems and things. And I'm sitting there, I'm thinking to myself, you think you got problems? Let me tell you, I've got this, and I went, whoa. Suddenly I had shifted from, being empathetic and understanding to being all about me and how awful my life was, and that was when I recognized it. So what you're saying, it really, really touches home with me.
Yeah, I mean, so that's kind of a common experience that I heard over and over when I was talking to different associates and who work in, I focus more on clinicians working in community settings and things of that nature, but recognizing cues, it's usually things you described, and it's just this sort of like, I'm here, I can't wait till this is over, and so there's some of the cues, but again, this isn't something that has been studied, in a thorough fashion. So the cues would be subjective, and perhaps down the road there'd be better methods of recognizing burnout cues so that we can take some action.
Yeah, so let me, because I want to go back and make sure I heard you correctly. So there are cognitive cues, there's emotional cues, and then there's, I'm going to call it meaning cues. Am I correct? It's
correct.
Sort of like what I went through. It's like you think you got problems. There's a cognitive, but it's also emotional in that there was some feelings that went along with it, but the meaningfulness wasn't there. You don't have to have all three, or
you can have all three. I mean, it's not like there's this clear, defined that they've quantified certain cues to look at.
Yeah.
But it's really subjective. I mean, another one would be, I hope my client doesn't show up. I may want to see them. I may need to see them. They're on my caseload, but if they don't show up, then I'm perfectly fine with that. So
right.
That's another cue. Yeah, so again, it's not really that defined of what cues you would look at. We know what burnout is, we know how to measure it, but we're not very good at recognizing the onset, at least in a quantified way.
Yeah. Okay, so I guess what I'm getting out of this is that it's really important for us as therapists and other caregivers like nurses and things like that, that we have some self-awareness of what's happening to us while we're providing the care.
Right. That's exactly right. And one of the things in looking at, I also investigated what are some effective ways of dealing with burnout. And clinicians that aren't burned out, according to the research, tend to have career-sustaining behaviors.
Oh.
So career-sustaining behaviors, and what that would include would be self-awareness was one of the core sustaining behaviors that reduced burnout or made you less vulnerable to burnout. The others would be sense of humor. Another important one that is how you maintain your values and your professional identity where you're working. Now, in my experience, we work in all sorts of settings, and certain settings have, maybe theoretical preferences or approaches. If we're able to hold on to our identity, hold on to our values and what we believe works, then we tend to be less burned out because we don't completely cave in, relinquish our whole integrity to just sort of doing kind of like a warehouse style therapy. We can actually, incorporate what agencies want, but also integrate what we're doing and what we believe in.
Yeah, I haven't worked much in agencies, so I can't really speak to that, but I know that, in working with associates and other colleagues and things like that, it seems as though there's more of a burnout rate, if you will, in working within clinics or those type of settings, bureaucracies, large care providing entities. It seems like the burnout's more there than perhaps in private practice, or am I just...
Right. No, your observations are extremely valid, and that's what the research has shown, that clinicians who are working in private practice settings are, for the most part, less burned out than clinicians working in hospitals, nonprofit settings, in-home therapist. So all the settings, that, clinicians find themselves in, private practice clinicians seem to be less burned out. And there could be several reasons behind that. At least with the associates I investigated, many of them are working in non-traditional settings. So it's one thing to go through school, to learn all the nice techniques, get some practice, and then now you got to go into a client's home you've never been in. You're going into their environment. Now you have to bring those approaches into the home. Now, I don't know, in my training, there's not a lot of education on those things, how to adjust, how to do therapy in a living room or in an apartment building when there's not the traditional setup.
It sort of brings to mind a concept, locus of control. It's sort of like, maybe I'm oversimplifying it again, but in a private practice setting, we see ourselves as in control. When we see ourselves in somebody else's home, that's their turf. And I know that having done nursing, in-home nursing, it's kind of an awkward, uncomfortable feeling because even though you're the professional, you're in their home.
Right.
And there's a sense of they're in control. And then, of course, in a clinic setting, hospital setting, there's a whole bureaucracy that's in control. So it just seems to me that locus of control may be something that plays into that. I don't know. Like
it does, and the research does also capture that. Studies have shown that, if you believe that the events that happen in your day-to-day, whether work, personal life, if you attribute experiences to something you can control internally based on the way you think, the way you act, then you are less burned out. So those that, don't believe they have an impact, they control their situation, those who maybe have an external locus of control tend to be more vulnerable to burnout.
Yeah, I'm glad you said that because that's something that I teach when I teach is in terms of locus of control, and that's something we have control over, is how we see the control. Do we perceive the control from coming from, do we perceive the control coming from without, or is the fact that we're in control more important? That's a perspective, isn't it? It's a perception, isn't it?
It's a perception, definitely, because in a Western culture, having an internal locus of control is something that's more common. But if you're from a different culture, many others believe in it, or have a perspective of an external locus of control, that we're dependent on others, we're dependent on the environment around us. So at least in a clinical setting, just off the research, at least when it comes to burnout, an internal locus of control is more effective in that setting, I guess in an occupational setting, than it may be in day-to-day living, and but it is an important construct.
The other thing that you said that I would like to touch on, only because I'm an existentialist, so I do this sort of stuff, is the meaning. When you talked about cognitive and emotional, and then you went into the meaning thing, and I went, ooh! I started thinking of Viktor Frankl and his book, Man's Search for Meaning, and I went, ooh, that's beginning to sound like that, where the ones that made it through the concentration camp were the ones that had some sense of meaning.
Right.
And although we're not in concentration camps, thank God, if we have a sense of meaning, that's going to sustain us, isn't it?
Absolutely. Obviously, in the references you made, it sustained those who were going through the concentration camps. But in the mental health setting, having meaning, and I think this is where the personal accomplishment component of burnout is important. Again, believing that what you're doing has a purpose, that it has an end game, that the time you're spending with the clients, the time you're spending at the agency is going to be effective. You're going to see the clients' lives improve. You're going to see that your agency is actually serving a community the same way maybe a church does, or another maybe educational institution, the way we actually provide for society. If you believe that where you're working can also do the same thing, then that has a meaning. There's a purpose to that. But obviously that's something that's hard to find meaning if you're more of the depersonalization component of burnout, where you're detached, where you don't feel like what you're doing is going to have any outcome, that it's all just, I guess, a sham. And again, I'm talking about the most cynical, clinicians. There's times where we all, we question some of the things we're doing, but I think for the most part, the ones that really believe in what they're doing and have seen outcomes and are actually sort of reinforced by their supervisors or other professionals who they see as successful, I think that gives it much more meaning. It becomes much more personal. So that is a sustaining factor.
Okay, so I guess I'm going to get altruistic here and say, in a private practice setting, we have the ability to sustain ourselves and see ourselves as being engaged in a meaningful endeavor because we're dealing just with the client. Now, in a clinical setting, then we, fortunately, we have to believe that what's going on here is not only just for the individual client, but has a societal value. I think I just lost my train of thought. Help me.
Well, I think working in an agency, I do think it's a little more difficult to define the meaning. You mentioned being in private practice, we have a lot of control over our work. We're working directly with the client. There's some meaning to that. I mean, at least in my first experiences in private practice, there's something about the client coming in to see you as the professional, as the provider. You collect the fee, you do all the notes. You have some sense of control, and I don't know. It was more. I guess it did feel a little more meaningful than if you're working for an agency where you're told, okay, kind of how you're going to run things. You're assigned whatever clients you're assigned. You have to do the billing and everything, the notes, the way they want you to do them. That does make it a lot more difficult. And one of the things I hear when clinicians, when burnout does come up, is, well, you need to do self-care. Maybe you should do some self-care.
Good, because that's exactly where I was hoping you were going to go, because we've talked about burnout and being aware of it and how it can happen, and what do we do?
Great question. So again, I guess there's 3 approaches that the research has kind of highlighted as, I guess, being the most popular methods of alleviating burnout. One would be self-care.
Okay.
Now, if I were to ask you and a dozen other clinicians what self-care is, describe it,
we all have different answers.
we all have different answers. So that's one of the problems. Now, that may seem kind of cool that it's so subjective, anyone can do it, but when you really want to pin down something, you want to get into science, being able to know exactly what it is, what works, what doesn't work, is what separates, pseudoscience from empirical science. So self-care, it's very broad. At least in the research I did, what I found is not necessarily what we do for self-care that's important, but what is it about those behaviors or practices that's effective. So the majority highlight a cognitive component, something, they use phrase like it made my mind less cloudy, something to take my mind off things. So any kind of self-care that can really addresses the cognitive component is important. The social component, being around people, even if you're not really doing a planned activity. Maybe you just go to a social gathering, maybe you hang out by yourself, but many have reported just feeling a little better being around people that, I guess, and not in a clinical setting. So we kind of get inundated in our work and we get so invested into the clinical part, and we're surrounded by clients and other professionals. Many saw benefits by kind of being removed from anything clinical, just being around day-to-day people that aren't in mental health or they aren't a client. And
So that goes way back to when you were talking about resources, and I think I was hinting at social supports. And it's kind of like what you're saying, that you want to be doing something that's mentally different, and you want social supports that are also different. It's nice to have a supervisor or a colleague that you can go to about a clinical issue, but when you're in burnout, you really want to get away from that, don't you? You want to kind of to have a social support that's different. Play golf or something.
Yeah, you want to be around just different people, a variety, and I guess that's that's the shortcoming of the research is, okay, social support, but what kind, what specific types? It's really unfounded, but. You do want to be around colleagues. Collegial support is also important. I guess it's more important for, I think, the personal accomplishment component of burnout. Being able to pick each other's brains, being able to sort of bounce ideas off each other. You can learn, you can gain a lot of wisdom. Like, me, if I'm talking to you, you've been in the field much longer than me. I can maybe pick up some things I wouldn't pick up anywhere else because you have so much experience. So the collegial support is important, I think, for the more performance aspect, but as far as the emotional aspect or the affective component, being around others, being involved in something.
Right. Yeah, you touched on something that hit me really hard there, because it's like when you go to a colleague, you're looking for, professional support. You want to feel that you have some sense of competency in what you're doing so that you can feel good about it. And then there again is that meaning to what you're doing.
Right.
And so you feel that sense of competency. So you would need to have that. But that doesn't necessarily mean you wouldn't burn out. So you still need the social.
You need the social, you need that. And I just want to point out that, these seem very practical, but it could be quite difficult if I went up to you, Oli, and said, I feel like a crappy therapist. My clients hate me. I hate my job. I don't know what to do. Not many clinicians may have the time to help out a colleague like that. It might turn into maybe this person isn't right for the field. Maybe you should take some time off. So it takes a lot of courage to kind of put yourself out there to seek these resources, especially the collegial ones, to say I need some help. I'm having difficulty with a certain topic or a certain type of client. These can be quite challenging. So the social support, self-care, I think another one is supervision. Now, at least what I've studied and what I've, come across is that, it's not necessarily more supervision that's more effective with burnout. It seems to be it's the quality of the supervision. It's supervision that isn't necessarily micromanaged. It's supervision that attends to not just the clinical performance, but also what's going on with the individual. What are some things they're dealing with? how's their personal life. I think also when it comes to colleagues, a supervisor who maybe, if they do have a role in hiring clinicians, they're not just hiring, who they think's the best. They're actually thinking about the interpersonal dynamics. So they hire clinicians to work together who maybe they mesh well.
Right.
Maybe there's a certain quality they're looking for. Right. So I guess a lot of things about supervision that aren't necessarily about just going through their paperwork.
Right.
All the nuts and bolts of.
Yeah, and I hate to keep bringing up existentialism, but it does bring to mind one of the things that we learned in existentialism is that you have to focus on who you are in that setting with that client. Who are you there? And so self-awareness becomes critical. And in supervision, you need to address that, I believe. And I hear you saying the same thing. It's like, you were good in that diagnosis and you're good in your treatment plan, but how are you feeling about that client? That's the component that I think you're talking about there.
That's an extremely important component. And I've had lots of supervisors, and the ones that really made an impact on me were the ones who provided a space for me to go into that, how I feel, even if it's negative feelings.
Okay. So, any last words?
No, it's just an important topic. I appreciate you having me on to speak about it today because what I didn't get to talk about, but it's kind of evident, it does impact your mental health, your physical health, diet, nutrition, all sorts of things. So it's very important, and it's something that shouldn't be taken lightly.
Yeah, and I thank you, Steve, for coming on. I appreciate all the work you're doing, and let's all try not to get burned out.
Right on. Sounds good.
All right. Thank you, Steve.
Thank you.
Okay, I want to thank you all for tuning in and watching this segment of the Therapy Corner. Again, one of the things that we try to do here is to destigmatize and help educate people about mental health and mental well-being. It's an important issue, and it's one that I feel we need to get out there. So this show is for you, and we're hoping that we can do whatever we can to help you to understand that. So again, I want to thank Steve for coming in.
Pleasure.
Appreciate it, and good mental health to all of us.